Coming up on this episode of Common Denominator.
We all have these issues about how we feel about our bodies. And plastic surgery allows people to change the image of themselves. It empowers them, transforms their life in many cases.
Hi, and welcome to Common Denominator, where we focus on human connection and what brings us together. I'm Moshe Popek, and we just had a really enlightening conversation with one of the preeminent plastic surgeons in the country, Dr. Miami. We talked about how plastic surgery is not just for vanity purposes and how plastic surgery can have a tremendous positive effect on your relationships. So check out the episode. Hi, Dr. Miami.
Thank you for having me.
Welcome to the show.
Nice to be here. I appreciate it.
So one of the most renowned plastic surgeons in the country.
Wait, why are you limiting me? Why not say the world?
Oh, well, the world too. I could do that too.
Yeah.
And it is true. It is true. But I want to start the beginning.
Sure.
What made you get into plastic surgery?
How long is this podcast? How far back do you want to go? So when I was a kid, I used to watch a show called MASH on TV, with Alan Alda, the Korean War. Sure. And I didn't know it was a sitcom when I was a kid. I thought that was like what surgeons did. They made jokes and saved people's lives and that sort of thing. It just looked like the coolest job. So from my earliest memories, I wanted to be a surgeon. I just didn't know what specialty to go into. I thought, trauma surgery, brain surgery. I really had never seen plastic surgery at all until I got into college. So when I got to college, I was pre-med. I started volunteering at hospitals. I saw neurosurgery, orthopedic surgery. My girlfriend at the time, who's now been my wife for the last 28 years, she got into a car accident and she cut her lip. She hit her lip right against the steering wheel, and it cut all the way through. You could see her teeth through her lower lip. And we went to the hospital, and some intern, some poor schnook on call, 2:00 in the morning, sewed her up, and it left a scar that looked like a caterpillar had landed under her lip. It didn't bother me at all. I was 19, she was 19. She was way out of my league to begin with. And so a little less self-esteem actually helped me to hold on to her, for me. Other guys, I've had less competition. But anyway, the point is that it bothered her after about 6 months. And so I said, well, if it bothers you, why don't you see a plastic surgeon about fixing it? And in those days, it was 1990 or so. There was no internet. She picked out the Manhattan Yellow Pages. And the way you picked somebody is you just found the biggest ad. And if they had color, it means they must be doing really well. So we picked the biggest ad. We got into the subway from Brooklyn, went up to the Upper East Side, some fancy office. And when she went in for a consultation, I was in the waiting room, and there was this like a wedding album of pictures. And before digital photography, you never really saw before and after pictures of plastic surgery. Almost never. People back then didn't talk about plastic surgery. It was one of those things that if you had it, you would cross the street if you saw your plastic surgeon to be on the other side, so nobody would ever know that you had plastic surgery. It was something that was kept hidden. You just burn all the pictures from before and nobody ever know. So, but on his waiting room table, there was this hardcover book of photographs, like a wedding album almost. And it was before and after pictures. It's noses and tummies and breath. And it was, to me, it looked like magic. If you've ever seen, good plastic surgery work and you see the before and after pictures, it looks like Harry Potter wizardry. It's like, where did the nose go? How did the tummy get? What happened here? And when she came out of her consultation, I was like, I'm a pre-med and I want to do what you do. And how do you do it?
Right. That was the hook, basically. That was
the hook. I was done. So when I started medical school, I went right to the plastic surgery department.
Sure.
Actually, at that point, I was 90% plastic surgery and 10% neurosurgery. Like one day with a neurosurgeon, I decided that was not for me. It was just way, way, way too serious. And a lot of, half your patients die, and it wasn't for my personality at all. But the plastic surgery department was a bunch of weirdos, creative weirdo types. And I was like, just fit right in. And so that was it. So from the age of 20, I started medical school at 20. And since today I'm 50, I've done nothing but focus on that.
It's amazing. What does a typical day look like for you? Because it looks crazy to me. I mean, from the social media.
It's not really. So I've done a few things to make my life easier. So I live down the block from my office. So I walk to work, get up, walk to work. I got a gym in the office. I got a whole little building that, I've got everything I need kind of self-contained on this little island here. of Bay Harbor Islands in Miami Beach. So I don't have to go very far. I don't even own a car. Like my wife has a minivan and my kid has a Tesla, and I just walk to work and Uber anywhere I need to go. So I come to work, I pray. I used to go to shul before Corona. I used to daven every morning, go to the mikveh. I haven't been back to that routine since Corona, but I probably should. Then I come here, I see my first patient, I mark them. Then I do surgery. In between surgeries, I do podcasts and see follow-ups and new consultations. I do TikToks.
So I think that the mere fact that you're bringing that all out to the public is super cool.
Yeah.
The name of the show is Common Denominator, right? And I always want to see kind of from you've been doing this all this time.
Yeah.
What is the common thread? I
would say like this. Okay. I would say to any surgeon or really anybody doing any job that's even remotely where you're the boss, or at least you can kind of control what you do. I would say find the thing you like to do the most and the type of people you like to work with the most, and just focus on attracting those people, whether through your marketing, through your hiring, through whatever you do. So like, in the beginning of my practice, I did a lot of facelifts. I was trained as all kinds of aesthetic surgery, facelifts, eye lifts, noses, tummies, blah, 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 everything, men, women, all kinds of things. And most plastic surgeons, what they do is they'll just take anybody that walks in the door, pays the bills, and I know how to do it, so let me just do it. No, the answer, whatever secret sauce there is for me is I slowly over time just narrowed down to just the operations I like to do because they bring me joy, and just the kinds of patients I like to operate on. So I imagine in my mind like what the perfect patient would look like or be, and then all my marketing efforts is all geared towards that particular person. So I only operate on women between the ages of 18 and 50, nobody over. I don't do facelifts. I do only mommy makeovers, BBLs, breasts, and some noses. But by marketing just to the people that I like, I end up with patients that like me. I call it letting the garden weed itself. So like I go on Snapchat, I go on Instagram, I go on TikTok. I make these, lunatic, sometimes funny, sometimes serious things. And for a lot of people, it'll turn them off. They'll be like, I'm never going to a doctor that's on TikTok. Great. Right. I don't want to be your doctor. Yeah. You know what I mean?
I think that's I'm a big believer. They say in the greatest point of leadership, you running your own business is authenticity. But I do know, and this I got to get to, because I do know, I see you mentioned before about your religious practices, and seemingly a little different off camera than on camera. Tell me about that balance.
So in my first years of doing Snapchat, I actually, that was it wasn't hidden at all. And when I went to the perm parties, I would show them, and all these obscure to the rest of the general public religious practices that Orthodox Jews do. I made it part of my Snapchat. They saw me doing brisses. They saw me doing all that kind of stuff. And I Snapchatted my daughter's wedding, which was in Jerusalem at a classic Orthodox Jewish wedding and everything else. It's very interesting. I love showing that, but that's not the main draw. You know what I mean? Like I show every part of my life. They've seen all my kids on Snapchat. Everybody knows who I am. I've been all over the world, been to Dubai, Saudi Arabia, I wear my yarmulke. Everybody knows who I am. But the main attraction of the TikTok and the Snapchat is the surgery aspect. It is the common denominator that we're all humans, and that doesn't matter what your religion is, what country you come from. We all have these issues about how we feel about our bodies. And plastic surgery allows people to, change the image of themselves, it empowers them, transforms their life in many cases.
Is that the
Doesn't
typical,
matter where you come from.
By the way, is that the typical, you talk about, what you're putting out into the universe? Is that the typical thing you're looking for? Meaning you want to heal people's self-image in a way.
That's exactly it. That's all I do. So that's what I do. I do basically psychiatry with a knife.
Right. Yeah. Right. Because I know that there's a lot of people, plastic surgery, that's bad. And I do know that, and tremendous kudos to this, that I do know that you do your not-for-profit side
Yeah.
for girl, right? I know. Tell us a little bit about what you do.
So I do a lot of stuff, some of it quietly, some of it more publicly. But yeah, I do free plastic surgery pro bono. For years, I still do something called Operation Chuppah. Like, if you can't afford plastic surgery and you're looking to get married, especially Orthodox women who are in a very kind of closed, limited, both financially and like from like knowing about plastic surgery and access to it. So done those over the years, for free, and then both men and women. And then they just have to invite me to the wedding afterwards. That's all. Not that I'll go, but years later I get pictures of that. And the other thing I do is I do circumcisions on Sundays for adults that need that for religious reasons. So I do that. It's like every other weekend or so. Mainly Jews from Russia or Cuba, Kazakhstan, or converts.
If you're joining us today, we're talking with one of the most prominent plastic surgeons in America, Dr. Miami. Next week, my guest will be Michelle Dempsey-Multack, a certified divorce and co-parenting specialist. We'll explore why divorce is sometimes the only answer and how to move through it with grace. So make sure to subscribe to Common Denominator so you don't miss an episode. And if you're enjoying this conversation, please feel free to leave a rating and review. Now, back to the show. What would you say is the biggest thing that has moved you, biggest story? In other words, a particular patient that sticks out. We can leave names aside.
There's so many. Like almost every. It's hard to pick like a specific patient because it's one of the reasons I went into plastic surgery is every story is unique. It's every story is unique, and there's so many people that lose 100 pounds, 200 pounds, and they go from, really being very unhealthy and unhappy with their bodies. And then they lose all this weight and there's all this skin, and being able to turn them, into a swan, from the ugly duckling in their minds, is really special. I've had patients. I mean, I remember one very early on in my practice where a lady came and she just thanked me. I did a facelift and eyes and stuff like that. And she said, I just want you to tell you, I was in the supermarket the other day and I turned an aisle and a guy looked at me and he smiled, and I had to turn around and I started crying because it's been like so many years since a guy has looked at me that way. You know what I mean? Like those kind of emotional changes. Or same thing with husbands and wives, where like they feel better and so their marriage gets better. I've got lots of stories like that.
Yeah, that is that's tremendous to materially change the way someone.
Yeah, because sometimes I'll operate on like a young girl, 18, 19, 20, and they're like very shy and they're like a wallflower because their nose is big and their chin is weak and they're just being picked on and whatever. And then they blossom into like, I see them like 2 years later and they're, blossomed.
Yeah.
And so that's all really meaningful to me.
What is, I was thinking like, you talk about, you're shifting a complete self-image. What's after the surgeries that you for the patients, is there some therapy they have to go through or some, not just physical healing, but it seems like it's a new persona type of thing.
Yeah, no, that'd be a good thing, but it really is not. It's not common practice. Most plastic surgery patients just kind of deal with it on their own. But you're right. I mean, look, over the years, I mentioned the good stories where marriages get stronger, but also sometimes it goes the other way because the husband can't deal with it, or the vice versa. The new image, they're used to having them kind of not feel great about themselves, and they're able to control them more. And now they feel more positive. They're getting attention from the opposite sex. So there's all kinds of changes that happen. It definitely changes. And the vast majority is positive, but sometimes it can go the other way.
And I know it was just interesting. Something I saw, first of all, you're known as the BBL doctor, right? So
yeah, I helped popularize it. I didn't invent it. I just helped popularize it.
Popularize it. Yeah.
Yeah.
So it's just
it's a very unique Miami thing, but it's now taken over the world. But it started in Miami.
Right, and I do know that you helped popularize it. But are there? And I've also heard that there's risks in that surgery.
There is. It's a very dangerous operation if done wrong. Yeah.
Right. So
Yeah.
it's
Very dangerous. I mean, look, no one's ever died in my practice, thank God. I mean, I have the technique that I've used for 20 years. It's very safe. But what happens is the popularity of the procedure exceeded the supply of doctors who know how to do it. So people would just kind of try it because the market's there for it. And, if there's a learning curve. And if it's that, and 18 patients have died in Miami in the last 10 years or 6 years,
wow.
something like that. That's really tragic. I mean, we do more BBLs in this part of the country than anywhere else, but still that number should be 1 or 2 or 0, We're working on that as a profession.
And what would you say is the top kind of 3 or 4 procedures? I know you're very specific in the procedures that you do.
Yeah.
What do
So
you see
BBL is number 1. BBL is most popular right now.
Right.
Liposuction in general, breast augmentation, tummy tucks, and those are breast lifts with implants and noses. Those are the things I do, and sometimes I do them all together. Where it's like somebody comes in and they leave almost a completely different person.
I know I see a lot on social media. They're really making a push on kind of like body positivity.
Yes.
What can we do as a society to become more tolerant?
I think everybody has to be body positive, and like I tell women, I mean, you have to like yourself. The fact that you're coming for plastic surgery, you have to have some degree of an idea of what we call, your locus of control. Some people have this attitude where the locus of control is external. That, the world is doing this to me, and nothing goes right for me. I can't control anything. Those people generally don't come for plastic surgery. They need psychiatry first to get to a place where they feel like, okay, I'm in control. I can go for plastic surgery. I can control how my nose looks, how my breasts look, how my tummy looks, etc. So in that respect, you have to have some degree of self-esteem and self-awareness of that. However, I'm not for being unhealthy. So there's going to be a clash between body positivity and just the good old fashioned healthcare system that is going to be like, wait a minute, I'm okay if you want to be overweight. But if you're overweight, understand it comes with diabetes, high blood pressure, stroke, cancer, all those other things. So the body positivity movement needs to recognize that they're also if by body positivity you mean like just be fat and don't worry about it.
Right.
That's kind of how I interpret when people talk about body positivity. Just be fat and don't worry about it. That only goes so far because eventually you come up against the medical reality, which is that you will be more likely to die younger.
Right. I think of a holistic, healthy lifestyle, healthy eating.
Yes, holistic, healthy lifestyle is fantastic.
Right.
Listen, you only come to me when you've done your homework and you've done everything you can outside of surgery. There's no machine in the gym for breasts that can lift your breasts or make them grow bigger.
Right.
You know what I mean? And there's no machine that's going to get rid of the stretch marks and the loose skin from having babies. That is always going to be there unless you cut it out.
Right.
Same thing with a bump on your nose. If you like it, great. But if you don't like it, the only answer is this. But everything else, if you can do it in the gym without surgery, do it. I mean, I turn away a lot of people.
And I think about, I always ask all guests, what's something top thing in your mind that you're grateful for?
I'm grateful for every day. I'm 50 years old. I'm in the bonus round as far as I'm concerned.
Yeah.
Every single day.
Yeah, I'm a big.
Like every day I wake up, I thank God that I'm alive, that I have 2 hands, that I have 2 eyes. I mean, there's no end to the gratitude that I have for everything. But of course, my wife, my family, 5 kids, I have a grandchild. I mean, those are the fact that I get to live close to my business. I mean, I'm so blessed. I'm ungestüppt with blessings,
Yeah, no, I'm a big fan of that. And I think we all have to learn to change our lens to live in a place of tremendous gratitude. So, just last question.
Sure.
What is something that that we don't know about you publicly? Putting you on the spot.
That's such a great question. I mean, what don't you know about me? I wear tzitzis. I don't know if everybody knows that.
well, we gotta talk because it's a mixture of things. So it's Yeah, no, that's a good one.
I don't really show off my tzitzis, but I wear tzitzis every day.
Right. So this is
People are going to start Googling.
right. No, it's a reminder that God's watching over us.
Yeah, it's a religious undergarment that Jewish Orthodox men wear.
So I like it.
The fringes, you know.
So Dr. Miami, how can people learn more about you and follow you on social?
How can people follow me on social media? The Real Dr. Miami on all social media. Twitter, Facebook, Instagram, TikTok, of course, Snapchat. The Real Dr. Miami.
Really, and
if you want surgery, therealdrmiami.com.
There you go. It's really been a pleasure, and really eye-opening for me as a layperson that it's never just about vanity. And I love where you're coming in with your heart, and really appreciate it. And thank you so much for your time.
You're welcome. Thank you. All right, have a great day, guys.
Thanks so much.
Bye-bye.
Bye-bye.
Thanks for listening to the Common Denominator Podcast. Join us next week for another inspiring, impactful, and empowering conversation. To learn more about Moshe, head to MoshePopak.com. And if you enjoyed this episode, feel free to share it, and we'd be grateful if you could rate, review, and subscribe to the show. Have a great day, and we'll talk to you again soon.